BOSCON 2026 brings together leading orthopedic experts in Bengaluru, spotlighting future-ready care *. Bengaluru, 4th April, 2026, *BOSCON 2026, the 29th Annual Conference of the Bangalore Orthopaedic Society, BOS, was inaugurated today, 4th April 2026, in Bengaluru and is currently underway, bringing together leading orthopedic experts, surgeons, and young clinicians for 2 days of high-impact academic exchange and clinical discussions. Organized by the Bangalore Orthopaedic Society in association with HOSMAT Hospitals, a leading name in orthopedics and trauma care now expanding into multispecialty services, the conference commenced on 4th April 2026 at the Koramangala Club and will continue on 5th April 2026. The inauguration ceremony was graced by Dr. Shantharam Shetty, Pro-Chancellor, NITTE University, past IOA President, as the guest of honor, marking a prestigious start to the conference. With the theme, Keeping Pace in Orthopedics, Evolving with Evidence, BOSCON 2026 placed strong emphasis on practical academic case-based education, PACE, focusing on real-world clinical learning supported by scientific evidence. The conference saw robust participation from across Karnataka and neighboring regions and featured subspecialty-focused scientific sessions, case-based discussions on complex surgical scenarios, evidence-driven panel debates and expert-led deliberations, orations honoring pioneers in orthopedics, dedicated academic platforms for postgraduate
Bangalore Orthopaedic Society Annual Conference. I am Dr. Shantharam Shetty, orthopedic and spine surgeon, and presently the President of Bangalore Orthopaedic Society for the year 25-26. Today we are celebrating our 27th annual conference, and it has been a success with our programs. It is started based on something called as evidence-based orthopedic practice, which is the need of the hour today, because our people are so educated, they are well informed because of the present information what they get on their phones, through internet, through the media. So we are also upgrading ourselves so that whatever demands or queries comes from our patients, because our patients are very, very informed and intelligent and educated. So when we talk to our patients, we also talk to them based on evidence. It should be very clear that the practice in orthopedics nowadays has taken to a next level, which happens based on evidence, and of course, there are new innovations on a day-to-day basis. The world is changing from a system which was quite primitive 10 years back. But within 10 years, now we have come to a stage where we do surgeries based on innovations which are happening, which is AI based, which is robotic based, which is computerized also. So in this regard, this scientific session which is happening is definitely a platform for all of us in the city of Bangalore, where we today have around 500 registrations in the city of Bangalore alone, and we are all getting our scientific sessions, which is again in orthopedics is subspecialized. We have now joint related, spine related, and the departments which is separately for foot and ankle, it's for the hand, knee surgeries, all this. So today we are covering all the subspecialty subjects in our discussion, and we are also taking this platform to felicitate our senior orthopedic surgeons, our teachers who have taught us, brought us to this level. So I will tell a few words like this so that we are happy also that our press is covering our BOSCON 26. I have Dr. Shantharam Shetty, who is the Secretary of Bangalore Orthopaedic Society,
and innovations, teaching, and it's an annual gathering of all orthopedics in Bangalore. So there are 500 registrations. We expected minister and senior delegates from Delhi, Chandigarh, all over India, pan India. So we want great success. We are like to thank you all for you people to support me for BOSCON 2026. Thank you.
At the outset, I'd like to thank you all for your time. So we are having our 29th annual conference hosted by our team, the Bangalore Orthopaedic Society team, 2025-26, under the presidency of Dr. Shantharam Shetty and myself, Dr. Shantharam Shetty, as the organizing secretary of this conference. We also have with us Dr. HP, who is the organizing treasurer. So it's a great privilege, and we can tell it with confidence and confidence that like around 60 pharmaceutical companies have participated today. We have around 500 plus delegates, which includes delegates from all over the state and from Bangalore, including the postgraduate students from all the recognized medical colleges in Bangalore who have participated at our conference and made this event. Thank you to one and all. Hoping to see you all once again soon. Thank you.
Is another 25 other cities of the state.
No, Karnataka.
Yeah, here we have outsiders. We have who come from Delhi. Dr. Vijay Gori, Dr. Suraj come from Delhi. Dr. Ashok Rajagopal is our most renowned orthoplastic surgeon in the country, who has done more than 30,000 knee replacements. He's come to address us. It is our honor to have Dr. Ashok Rajagopal in our conference this time. So it is our pleasure to have them also.
Doctor, what is the biggest challenge?
The challenge
only take away from BOSCON
26. Yeah, BOSCON 26 is based on bridging generations, innovating, cultivating innovations, and honoring legacy. That is our theme. And our theme of the conference is keeping pace in orthopedics, evolving with evidence.
Challenges.
See, the challenges are definitely when it comes to the patients who are now so educated. So there was days where the treatment, when it went on, they were accepting. But today we have to be on our toes. We have to be fully skilled. We cannot be less skilled, try to do some work which is not going to help the patients. So our strength, our challenges is keeping up to the skills and the practical skills which is supposed to be gathered or garnered by ourselves. That is our challenge, so that we give the best results to our people.
Doctor, so what is the assurance that you want to give to the next generation?
Sir, I heard that the involvement of the doctors or the orthopedic surgeons is reduced when there are innovations and the technology which is coming. That may not be true at all, because at the end of the day, the best results, when it's delivered to the patient, it always comes through the hands of the surgeon. They are only the assisting tools for our surgery, but the decision making is definitely the surgeons and the surgeons' brains.
This is the assurance that we want to take it from.
Yes, we talk about the patients who are aging. That's definitely a very, very important part of our practice, because when it comes to aging, it is always we try to give them advanced treatment where they have preventive measures. When we help them, when we see them in the come with back pain or pain resulting due to knee arthritis, they are all part of the aging. So, but we try to give them advice about how to prevent further problems. we try to help them by treating with medicines, which are nowadays, we have very good medicines to prevent bone becoming weaker and more fragile, which we call as osteoporosis. So in our patients who are elderly and aging, we have very good medicines. So in our practice, it is not only that we operate, we are also orthopedic physicians, where we treat them so that they don't get into a stage where they need surgery. So this is our preventive mechanism where they definitely know how to do things so that they don't land up in fractures.
When people talk about their works, their innovations, their techniques, and also it's a bonding between the doctors. So the doctors from different parts of the state or even Bangalore, we don't get time to meet up. So this forms a good platform so that we can discuss challenging cases. So we won't be experiencing difficulties with the cases we operated. Say like the other doctor who has operated elsewhere will share his experiences. So it's basically a good learning curve, learning experience, and basically it will help us give a better output to the society, learning from failures, learning from the experience of other doctors, sharing success stories. So then the humanity will be benefited.
What are